From The Times and The Sunday Times, this is The Story. I'm Daniel Gordon.
If the witness could be sworn, please.
Last October, a smartly turned-out blonde woman in horn-rimmed glasses was sworn in to give evidence at a public inquiry.
I, Melanie Leahy, swear by Almighty God that the evidence I shall give shall be the truth, the whole truth, and nothing but the truth. Today marks a deeply personal and historic moment for me.
The culmination of a campaign she'd led for more than a decade.
After 13 years of campaigning for truth and accountability following the death of my son, I appear here today before the Lampard Inquiry.
Melanie's son, Matthew, died while sectioned on an acute mental health ward in Essex, and she's been fighting for answers ever since. The result has been the Lampard Inquiry, which begins hearing another section of evidence this week. It's investigating the deaths of over 2,000 people who received mental health care across the county in the space of more than 20 years. Deaths which may have been preventable. More than 70 friends and loved ones of those patients have already told the inquiry how their lives have been changed forever.
It was our family's great misfortune that our beloved Richard should fall victim to the Trust's dangerous practices.
And I am still no closer to understanding how, over a period of 10 years, you faded before our eyes, following what was supposed to be a 2-week assessment.
Pippa's death was a tragedy, and it is still felt by family and friends today. Had she received more localised, continued and appropriate care, there's a good chance she would still be alive today.
Today I'm going to tell you some of what's been revealed at the inquiry so far. No frontline staff members have given evidence yet, but one has spoken to me. And why did you leave?
Because of the failings, the continued deaths that were happening.
I should warn you, this episode contains distressing material, including descriptions of suicide. The story today: Britain's Mental Health Reckoning, Part 2, The Whistleblower. Investigating over 2,000 deaths, spanning more than 2 decades in a county-wide mental health service, the Lampard Inquiry was always going to be wide-ranging. But watching the evidence, some topics come up again and again and again. Today we're going to focus on 3 of those issues, and we'll start with staffing. For that, I need you to meet Dawn and Craig.
Could you state your full name for the record, please?
Dawn Ellison Johnson.
Craig John Scott.
Thank you.
Dawn and Craig appeared in front of the inquiry late last year to talk about their mother, Iris.
You are the daughter and son of Iris Scott, who was born on the 5th of December 1940 and who died at the Linden Centre on the 1st of March 2014, yes?
Yes.
Iris was 72 when in 2013 she was admitted as a voluntary patient to the Ruby ward at the Linden Centre in Chelmsford. It was meant to be a 3-week stay to try and get on top of her extreme anxiety. But Dawn and Craig told the inquiry they were almost immediately concerned that staff appeared thin on the ground.
In terms of staffing arrangements, you both noted very, very low levels of staff.
Yes.
A lot of bank staff.
Correct.
And an incident you mentioned, Craig, is one where all members of staff on the ward but one had to attend, I think, the other ward, which was Topaz, for an incident, leaving one staff member for 15 vulnerable patients at that time on Ruby ward.
Yeah, and there was also another instance where there was one gentleman helping a patient to their room, and I actually said to him, of course, like, my words along the lines were, I bet you're doing this all the time. His direct response to me was, and I almost quote, I'm a patient, mate, I don't work here. Then that just took my breath away a little bit.
On a mental health inpatient ward, Observation, whether that's every few hours or constantly keeping a patient within eyesight, can be a critical part of safety plans. And Iris's family felt that the nursing staff they did see had had little by way of training.
I understand that staffing levels can progress,
yes.
People can get trained up, etc. But I'm not quite sure how you go from, in one example, serving a cup of coffee from behind
the cafeteria
centre,
yes.
which was directly on the ward, to then effectively administering medication in a relatively short period of time. I would have expected more supervisory guidance, tuition. We didn't see that.
As time went on, Iris became increasingly anxious, and Dawn and Craig started to worry that the levels of staffing and training were putting their mother at risk.
You found a pill, some sort of medication in the pocket of her jeans.
I did, yes.
Called the ward, spoke to the ward manager who said...
I actually showed them, I think it took the back, and they said, but that's not one of your mother's tablets, that's not medication she's on.
Yes.
I said, well, you're missing the point.
Why does she have
it? How has my mum got anybody's tablets? How has she got this medication? And it was just dismissed. It was almost, why are you raising this point?
There's a shortage of mental health nursing staff right across the country. The Care Quality Commission says 9% of roles in NHS mental health trusts are unfilled. Often those gaps are plugged by temporary workers, either from an agency or by NHS staff with jobs elsewhere doing overtime, what are known as bank shifts. The inquiry won't be hearing from these frontline staff until the summer. But I've met one member of staff in Essex who started working at an acute inpatient unit in the early 2020s. That's the tail end of the period that the Lampard Inquiry is focusing on, and she's agreed to share her experience.
When I went into healthcare, I was always told to treat those how you'd want to be treated or how you'd want your loved ones to be treated, and that very rarely happened.
She asked me not to use her real name, so I'm going to call her Anna, and her words are spoken by a producer.
Having mental health in the family, I spoke up for them. I was there for the patient, so I wasn't there because it was a job.
Anna worked at the Linden Centre. It's a squat brown building in Chelmsford. You may recognise the name because yesterday we talked about Melanie Leahy, who died while an inpatient there. Were people on the ward still talking about Melanie Leahy's death and some of the other people who had died at the Linden Centre when you were working there?
His name was mentioned a couple of times when there were failings.
One of the investigations into Melanie Leahy's death noted that over half the staff on duty at the time were temporary. Yet when Anna worked there, roughly a decade on, she says things hadn't changed.
It was more bank and agency when I started than permanent staff, yeah.
And she believes agency staff were less dedicated to patient care.
The full-time staff that were there all the time, they engaged with the patients and they knew the families and things like that. But when you've got bank staff and agency staff, the staff that just used to turn up, they didn't engage, they didn't care.
Anna also says she witnessed an unusual practice among some of the temporary staff to swap shifts.
I did nights for a while, and there was a load of cars in the car park, and I didn't know why. And it was people waiting for shifts. One of the site coordinators at the time would ring. They were her friends. She would ring them and give them shifts when they were short.
And were they fully qualified to be doing that sort of work, do you know?
I know on one occasion when I've been on shift, someone had put their name down for the shift, but he double booked. He was working elsewhere and he had sent his cousin to work. So I don't know if this person was qualified or even on books or even had done the training.
Essex Partnership University NHS Foundation Trust told us it has robust vetting checks in place for all bank and agency staff. Staff must display ID badges at all times, and identity checks are carried out at the start of shifts when workers are not known to the department. I asked Anna if she'd ever witnessed staff members mistreating patients, and she remembered 3 of them goading a male patient who was suffering from paranoid delusions.
In the end, this patient ended up kicking and hitting one of these staff members because he wouldn't let him get out of the door. And they were calling for me to help restrain him, but obviously I didn't have the training, so I wasn't going to restrain. And I quite clearly said that you've goaded him, you wound him up. You deserve what this patient does to you, really, because how would you like it if it was one of your loved ones? Why are you laughing at him when he's paranoid?
And when you say they were goading, what were they saying to him?
He was talking to them, but they were sniggering, laughing like he was asking them a question they weren't answering, but just laughing at him.
The Trust told us all patients deserve to be treated with dignity and respect. Staff on its wards, the Trust added, are focused on providing therapeutic, compassionate and trauma-informed care to meet patient needs. Let's return, though, to Iris, who in 2013 had been admitted to a different ward in Chelmsford to treat her anxiety. A couple of months in, her children, Dawn and Craig, told the inquiry she started to express suicidal thoughts. Then they received a phone call. Iris had been badly bruised. She and nursing staff told them that she'd fallen, but Iris later admitted to her family that she'd tried to take her own life. Nursing staff, however, continued to deny that this was possible. Dawn and Craig told the inquiry that the centre's adamant refusal that she could have made a suicide attempt even led to tensions between Iris and the staff.
It was a situation where the ward manager went into my mum's bedroom and shouted at my mum that she had overstepped the mark this time. They actually said to her that if she didn't change her story, they were
going to reveal something about her
that didn't need to be revealed, and it was it was blackmail, basically. I mean, that's no way to treat her after something like that has happened.
Dawn and Craig found evidence in their mother's room of Iris collecting cords and other material that could be used in a future suicide attempt. But then Iris told a doctor that she wouldn't even know how to harm herself, even if she wanted to, and regular observations of her in the unit were stopped. Days later, on the 1st of March 2014, Iris made another suicide attempt. And staffing issues meant that it took some time to get into her room.
The senior nurse had gone sick that evening. Basically, they were short-staffed that night.
Yes.
They only had one card between the 3 people that were on duty to access rooms, and one of the person that had the card was in a different part of the Crystal Centre.
By the time paramedics arrived, Iris was confirmed dead.
After Mum's death, we went to the ward to collect her things, and the staff, there's no sympathy, empathy. They just kept referring to Mum as the body. I had to walk out because I was about to lose my temper.
Yes.
24 hours earlier, she was under their care.
When considering the deaths of more than 2,000 patients in the care of mental health services in Essex, the Lampard Inquiry often returns to one crucial question: how patients were admitted into the service and how they came to be discharged. When to keep a patient in hospital can be, for some, a life or death decision. And to really understand this, I'm going to introduce you to Adam Rowe.
Mr. O, welcome. Please make yourself comfortable.
I, Adam Rowe, do solemnly, sincerely and truly declare and affirm that the evidence I shall give shall be the truth, the whole truth, and nothing but the truth.
Adam gave evidence to the inquiry last summer. He was speaking about his mother, Amanda Hitch, who most people knew as Mandy. Mandy had worked as a teaching assistant in a primary school and was proud of her Cambridge University qualification in special educational needs. But when Adam was just a teenager, he noticed that his mother's behaviour began to change. In 2015, she was admitted to the Linden Centre.
She told me that she was hearing voices in her head and she thought buildings were moving and talking to her. When I visited her in hospital, she told me that someone was trying to kill her. It was heartbreaking for us to see her as a family, to see her level of distress.
Mandy would be diagnosed with bipolar affective disorder. Over the next 5 years, she was in and out of hospital. And during that time, she started telling the people close to her that she felt suicidal, even describing how she planned to take her own life. But what made Adam feel most uneasy was that over time, he felt that she'd worked out how to hide her distress and her plans from certain senior medical staff, so her suicidal thoughts wouldn't keep her in hospital.
She knew exactly what to say to the consultant psychiatrists to avoid either being admitted in the first place, sectioned in the first place, or being discharged, about being discharged. And it got to the point where at the Linden Centre there was one particular discharge meeting where she was being explicit to me. She had exactly what she wanted to do. She wanted to throw herself in front of a train. That hadn't changed. She was being really, really verbal about it and telling the psychiatrist something completely different.
And this was the point where Adam realised that he was going to have to intervene if he wanted to keep his mother under inpatient care with the high level of observation that came with that.
I got to the point of asking her closest friends and family, including myself, to write formal letters to the psychiatrist. And I brought them with me to the discharge meeting.
And his strategy paid off. Supplied with a pile of letters from loved ones, each concerned about the consequences of Mandy being discharged, her psychiatrist was persuaded, and Mandy was kept in hospital for another few weeks.
At which point she actually had become definitely not better, but was in a better state and a slightly less crisis state. And that for me kind of summarised how, without that level of kind of galvanising almost a group of people and having it formally written on paper, how you had to go that far to almost say, I'm being serious here. Like, you need to listen, because if you don't listen, something bad is going to happen.
But not everyone has a group of people who are going to be able to go to extreme lengths to protect them. Anna, the former staff member from the Linden Centre, whose name and voice we've changed to protect her privacy, told me about a similar incident that stuck with her.
This time last year, there was a male patient. He kept himself to himself, but engaged with staff. He used to sit in the garden, vape, and interact with staff before going out and leave. And he did mention a few times that he didn't feel safe to go home, didn't feel ready to go home. This was put in notes. This was escalated and verbalised many times. He even stated in one of his ward reviews, I believe in November, that he didn't feel safe enough to go home. Within 3 or 4 weeks, he changed that didn't feel safe to, I'm okay, I want to go home. But some staff still had concerns that he wasn't right. They still went ahead with this discharge. There was no management on shift the day he was discharged. There was no band 6s.
NHS staff are arranged into bands of seniority, and in this case, the band 6 Anna is referring to would be a more senior nurse.
There was no manager on site, and there was no service manager. And I don't believe the day that he was discharged that there was a matron on shift. A band 5 discharged him. They failed to let next of kin know that he'd been discharged. It wasn't until next of kin rang the ward to come and visit that the nurse then panicked and said, "Oh, I'll have to ring you back." The brother, from what I can recollect, the brother then went to the property and raised the alarm. that he wasn't there. Things didn't appear right, and he was found dead.
And they hadn't even, the family were not even aware that he'd been discharged?
No.
We put all of this to the trust, and they told us that consultant sign-off is required for any patient discharge. And then the administrative process will be handled by the nursing team and ward colleagues. Patients are assessed by their multidisciplinary care team, which ensures appropriate community physical and mental health care is in place, supporting patients to stay well when they leave hospital. The story Anna tells me, we should remember, takes place in the same Essex inpatient centre which Mandy had been discharged from. Despite her being discharged later than had initially been planned and in a more stable state, Mandy's suicidal thoughts eventually returned. There were some hospital stays, but for the most part she was treated as an outpatient. The inquiry heard she'd often pay visits to her local station, and when she got there, she watched the passing trains carefully. In January 2022, Adam met up with his mum for dinner, and he says she told him in great detail how she planned to take her own life. Adam panicked and immediately tried to get her back into hospital.
I was basically saying she has to be sectioned, or she has to be admitted, or there has to be some kind of significant increase in intervention here. And the response was, it's not high risk enough, not significant enough for admission or section.
He couldn't believe it. His mother had laid out her suicide plan and was visiting a train station regularly, and yet she wasn't deemed high risk enough for readmission.
I specifically asked what would be high enough, and the response was kind of attending every day or multiple times a day or being on the track itself, at which point I was just blown away.
Mandy wasn't admitted to hospital, but the following week she did have a planned medical review with her psychiatrist. During that meeting, in front of medical staff, just as before, she told a very different story.
She said although she would like to act upon her thoughts of jumping in front of a train, she strongly denied any intention to do so. The risk was recorded as low at present, but unpredictable. This was your mother's last contact with an EPUC clinician prior to her death.
Correct.
9 days later, Mandy ended her own life, just as she'd said she would.
By that response around, that's obviously why people die in these situations, because you've given it one chance to too many.
While some of the deaths the inquiry is investigating occurred after patients had been discharged or not admitted, many of them took place while they were still being cared for on a ward. You might remember Melanie Leahy from yesterday's programme. Her son Matthew was admitted to the Linden Centre, and Melanie was told not to visit him for the first few days.
I was told to leave it a week, let him settle on the ward and come in. So I was literally going in that day that he died.
You'd planned to go in that day?
That was the review day. I was due to visit, yeah. He'd done his week, I could go in.
The day Melanie was due to finally visit Matthew, she received a phone call to say he'd been found unresponsive in his room. Hospital staff said that he'd used a ligature point. That's a place in a room where a cord or rope could be fixed so that a patient could harm themselves. I'm sure you'll understand why these can be literally life-changing in an acute mental health setting. And this is the final issue I need to tell you about. Because throughout the evidence, the Lampard Inquiries repeatedly heard how patients on closed wards were left with access to the means to harm themselves. More than a decade after Matthew's death, when Anna was working at the Linden Centre, she says this was still a problem. Before our meeting, she sent me some photos of the ward. So you sent me these photos. What's this one, which is looks like an open cupboard with a lot of cables inside?
Outside the male acute ward, just before you get to the search room, that's the ceiling tiles. And it's anyone of 6 foot can touch it, put their arms up and reach. Contractors had been in, the electricians, and they left it just like that.
Anna says this was the entrance lobby to the ward where she worked, the so-called airlock. It had a door at either end, but patients who were returning from a trip outside could be let through the first door if somebody happened to leave the ward at the same time. And then they'd potentially have to wait in this enclosed space until the other door, that's the one leading into the ward, was opened. That could be a significant amount of time left unsupervised in an area with exposed cables within easy reach. Again, this was a photo of the Linden Centre taken more than a decade after Matthew's death. Ligature points aren't the only way a patient can harm themselves, of course. Anna also sent me a photo of one of the sinks on the ward. The sink with plates and cutlery.
China plates and metal cutlery.
Right, which are just left there.
Yeah, they could break that and self-harm, or hurt each other, or use a fork to stab someone.
Metal cutlery is supposed to be banned on the ward, with only plastic allowed. But this was just sitting beside a sink in a communal area inside the ward, accessible to all the patients. And were you seeing this kind of thing regularly?
Yeah.
We put Anna's photos to the trust, and they said any access to sharp objects, even down to tweezers and cutlery, would depend on a personalised risk assessment taking into account individual patients' history and current mental state. Do you think that the inquiry will bring the answers you're looking for?
Hear the pause. I really don't know.
Up to now, the Lampard Inquiry has heard 37 days of evidence, most of it coming from bereaved family and friends. But I wanted to end with Melanie Leahy. She's the woman whose decade-long campaign is the reason this inquiry began in the first place. Melanie gave evidence for the first time back in October.
Today marks a deeply personal and historic moment for me.
In the cruelest of ironies, though, it wasn't Matthew that she was talking about, her son whose death had started her fight for answers. That evidence will come later on in the year. In October, she was actually speaking about another loved one.
The thing is, I said I'd be waiting a long time for this moment, but I hadn't been waiting a long time to give evidence to Colin. I wanted him to be in the audience.
Melanie's partner, Colin Flapp, was a former professional footballer, and he died in 2021 while Melanie was already in the midst of campaigning for the Lampard Inquiry to be held.
You know, he put up with me living this, having to listen to me reading out documents or reading my emails and correcting them for me, putting up with me being awake 3 o'clock in the morning writing to somebody. He put up with all that, and I expected him to be there watching the results, not to be part of it.
Colin didn't take his own life. He died in hospital after a fall. But he's included in the inquiry because in the months before he died, he'd briefly been sectioned under the Mental Health Act. During that time, Melanie says she was again left in the dark about his treatment and frustrated by the decisions that were taken.
A lot of families in this position, we've lost trust in a lot of people. It's very difficult, but I will do my damnedest to get out as much as I can.
Even after all these years, Melanie's still making the case for why this matters, why we all need to pay attention to the state of our country's mental health services.
Right at the start, my very best friend said to me, Mel, stop this, you know, Matthew's died, just let it go. And then her daughter, very unexpectedly, ended up being in the Linden Centre just for one night. And she ended up in the Linden Centre for 3 hours waiting while her daughter was discharged. And the phone rang and she said, don't stop. She said, I've only been there 3 hours. It's hell. You've got to carry on. I've got your back. And I think unless people experience it, it's hard for them to understand. And sadly, more and more people are having to turn to these services.
The mental health charity Mind says that 1 in 4 people in England will experience a mental health problem of some kind each year. The final report and recommendations from the Lampard Inquiry aren't expected until 2028. But in the meantime, 2 other regional mental health inquiries are due to begin, one of them in Nottingham and the other one in the northeast of England. As questions grow, Britain's mental health care may finally be facing a reckoning.
Ultimately, I want as many answers as I can, people held to account, and then I really want to go on to change some laws, because I think that's what's going to bring about the major changes, not recommendations. Law needs to change.
The producers today were me, Daniel Gordon, Edward Drummond and Taryn Siegel. The executive producer was Kate Lamble, and sound design and theme composition were by Mao Lassetto. If you've been affected by any of the issues you've been hearing about, then please check the show notes for organisations that can help, charities such as Sane and Mind, both of which run helplines. Thanks for listening. See you again soon.